Next question, member for Orléans.
Thank you very much, Mr. Speaker. My question is for the Premier. For months, the Premier and his Minister of Health have been talking about the importance of testing as part of their COVID-19 strategy. But public health leaders, city councillors, our mayor, members on this side of the aisle have all been pointing to the glaring lack of capacity in our nation's capital. Capacity is so bad, Mr. Speaker, that lines are forming hours before the testing centres open up. Imagine waiting 4 to 6 hours in line with your kids outside without washrooms, Mr. Speaker. Now imagine doing that in November and December in Ottawa. Yesterday, residents in Ottawa were turned away from critical COVID-19 tests. When is the government going to release the billions of dollars in federal Safe Restart money to ensure that there are equitable and accessible testing capacity in our nation's capital?
Minister of Health.
Well, I thank the member very much for the question. And it is a problem in several locations, in Ottawa, I know, in Toronto, and other locations across the province where people are having to wait for inordinate lengths of time to have a test. We want them to be tested. Anybody with symptoms, anybody who believes they've been in contact with someone with COVID-19 needs to have a test, but it needs to be done, as I said before, in a timely manner. So we have expanded our testing capacity considerably since March, when we were doing 5,000 tests per day. We've expanded that capacity so that we can now do 25 or 30,000 tests a day. We're going to increase that capacity to 50,000 tests per day because we want people to be tested, and we are actively looking for ways to expand that, whether it's by expanding the hours or times that the 148 assessment centres are open, or by opening new places for people to be tested. We're very cognizant of this issue, and we are dealing with it as we speak.
And the supplementary question.
Supplemental is also for the Premier, Mr. Speaker. Residents of Ottawa's suburban and rural communities have to drive so far to access COVID-19 tests that it's often closer to drive to a neighbouring town, putting pressure on health systems in places like Rockland and Kemptville and Arnprior. Residents in Orleans have been calling for a local testing centre since the spring, and I've heard the same calls from residents in Canada and Barrhaven as well, Mr. Speaker. Yesterday on Moody Drive, hundreds of residents were waiting hours on the side of a gravel shoulder road in Nepean for hours on a shoulder gravel road next to a very busy road waiting for their COVID-19 tests. Why do the residents of Ottawa's rural and suburban communities have to drive so far and wait so long to get a critical COVID-19 test?
Minister of Health.
Well, thank you again, but we have expanded the capacity significantly in a very short order, and we are going to significantly expand it again, because we know that with people going back to school, with people returning to work, with people wanting to visit family members in long-term care homes or retirement homes, we have boosted the capacity significantly in the last short while, and we're boosting it again. We are making plans to expand both the testing capacity and the lab facilities, because of course you need to have people be tested in good time, but also to receive their results very quickly as well. So we want to make sure that people can receive the results within 24 hours. So we have plans to do that. Our fall preparedness plan is dealing with that. We are looking for those locations now, both in terms of expanding testing facility, but also our lab facilities, so that anyone in Ontario, in the Ottawa area or wherever else it may be, can receive those tests, because we want people to be tested. We know that we're facing a wave 2, as well as flu season, so we need to be prepared for that, and we will be.